Alrighty, welcome back. A new report from the American Cancer Society shows breast cancer is rising in young women and Asian Americans. This comes as October marks Breast Cancer Awareness Month. Certainly a timely conversation to have. It hopes to keep you and your family safe. Dr. Erika Hamilton with SCRI Oncology Partners here in Nashville joins us now to dispel many of the myths associated with this terrible disease. Dr. Hamilton, always a pleasure to have you here with us on Good Morning Nashville. We were just talking moments ago. I have a friend whose aunt literally was just facing this diagnosis. And so it's certainly an important conversation to have. Let's start with, I loved how you said, let's talk about the myths, because I think sometimes people they believe these things they hear or read online, and sometimes it's not always true, especially in this society. So let's start with the first one. Someone will say, I live a healthy lifestyle. I'm not at risk of this at all.
Absolutely. So obesity certainly can be related to breast cancer, but in fact, even those with the healthiest lifestyles, diet, and exercise are at risk for breast cancer too. 1 in 8 women will have breast cancer at some point in their life, and so regardless of your lifestyle, you need to be starting your mammograms at least by age 40 and getting them yearly, because we want to find these cancers early when they're very curable.
Absolutely. And then kind of going along with that, some women will say, well, I've had no history of this in my family, so I live a healthy lifestyle. I have no history of it in my family, so I also don't need to worry about this. But that's not always true. Another
common myth. So just like obesity, having a family history of breast cancer does increase your risk, but more than 90% of women, their breast cancer is completely unrelated to family genetics. So just plain bad luck. And so that's the reason that even if you don't have cancer in your family, you still are at risk and you need to be getting your mammograms. We also know that breast density is related to cancer risk, and this is now disclosed on mammogram reports. And so if on your mammogram report it says that you have a high breast density, you actually can talk to your doctor about maybe even other screening tests like ultrasound or breast MRI.
Which would be something to consider, obviously, because a lot of this is preventative. If you just catch it early,
exactly,
all hope is not lost, essentially.
Highly curable if we catch it early.
Of course. And then kind of going along with that, another myth that I thought was super fascinating is some women will say, I live a healthy lifestyle, there's no history in my family, so I don't feel anything is wrong, so I'm not going to worry about going to get a mammogram. And you would say, hey, starting at age 40, consider this.
Absolutely. So certainly if we feel anything abnormal, that's definitely of concern. But most of these very early breast cancers that we're trying to detect early, so there's very high cure rates, you can't feel them. And so regardless of breast self-exams, even if you're diligent about this, you got to get your mammogram.
Awesome. And then what I wanted to wrap up with, because I think sometimes when someone's facing a diagnosis like this, it could really feel like there is no hope left, because that's the word no one wants to hear is you're diagnosed with cancer. The clinical trials, though, a fascinating component there is that can actually be utilized very early on for some folks.
You're absolutely right. So common misconception is that clinical trials are for people that don't have treatments left. In fact, a lot of our clinical trials are in the curative setting. People that maybe are already cured, and we're talking about surveillance, how to catch if cancer comes back. So we really believe at Sarah Cannon that clinical trials should be considered first, not last for cancer care.
Just a fascinating conversation. Dr. Hamilton, thank you so much for always being here and giving us a great conversation. Above all, if you're listening to the conversation now, you would just say, hey, go ahead and make that appointment. Go ahead and do it. And real quick, why is it that some women just don't want to do it? Is it just an uncomfortable thing to consider? What would your message be to them?
Yeah, I mean, I think a lot of human nature is we like to think that we're not at risk for bad things, right? So it's kind of the sticking our head in the sand approach.
Yeah.
And then for some women, it's an issue of access, right? Maybe they don't have health insurance. Maybe they take care of others, whether it's children or older people in their home, and it's hard to get away to get the mammogram during business hours. So there's a variety of factors, but it's only once a year, and it's really worth it because if we catch these early, they're cured.
Certainly a game changer. So making this a priority is the takeaway from this conversation.
Absolutely.
Dr. Hamilton, thank you so much. You can find this interview online at WKRN.com.